Now, you were saying earlier off camera that these programs are relatively new in South Africa, 18 months or so. But I mean, this has been practiced abroad for many, many years,
Yes.
and the benefits are actually far-reaching, sort of as far down as reducing antisocial behaviour, reducing crime, etc. Please explain that.
So the handing out of needles and syringes doesn't happen in isolation. There are 9 or 10, depending which version you look at, recommended services from the World Health Organization, the United Nations Office on Drugs and Crime, and PEPFAR, the Centers for Disease Control of the United States, and many other organizations recommend these services. And they include things like HIV testing. They include peer-based services, which means that people who understand the community, who are part of the community, go and deliver services. Some of them are active drug users still, who are delivering the services. They gain the trust of the community. We see behavior change interventions, and we see basic wound care. So, you know, if guys have got abscesses, we help them with that, and referral processes. So what happens is people who've been very excluded, highly criminalized, suddenly see that somebody cares about them. And that has an immense effect on people who've been highly marginalized in the past. We don't care whether they smell. We don't care whether they've got seeping wounds. We don't care if they look terrible. We welcome them. And we say, we're here to give you what you need. And just by doing that, we see people's attitudes change. And we see people feeling better about themselves. And then their attitude towards the rest of society changes as well. So, for example, we see a lot of guys actually going out and actively picking up inappropriately discarded medical waste, you know, which was always around there. It wasn't as if it suddenly appeared, but they're now actually picking it up. They're caring about it, you know.
I guess more important, yeah, I mean, the most important outcome is, and I guess what needs to be put out there to change people's perceptions that it's not proven to increase drug use.
Yes, absolutely. And I think that's a common misperception. You know, it's like handing out condoms doesn't increase sex. You know, people don't stop having sex because they say, oh dear, I don't have a condom. Well, a lot of people don't, let's put it that way. And it's very similar often with drug use. Drug use serves a purpose in a person's life. Their motivation for drug use is quite strong. For a lot of people, it's a form of medication or self-medication. For some people, it's a form of belonging. And so it carries deep meaning with it. And stopping is not an option. Even, in fact, when guys, they've damaged their veins so much, they end up injecting into their neck or into their groin, which is not a pleasant thing to do. But they do it because they think that it's worth the risk, you know. And if we handed out clean needles and syringes, we'd find that people wouldn't develop those kind of problems. You know, they would be able to still inject in their arms if they knew the correct way of injecting.
And also proven to reduce HIV transmission by up to 40%. I mean, that's massive.
It is massive. It is massive. And the other figure, which people often don't mention, is it reduces mortality by up to 75% in some studies. And for me, you shouldn't really have to go beyond that argument. We know from the data that the majority of people who have an issue with their drug use, where they find it causing them problems, will resolve that over time, often without treatment. But if they resolve it and they're still, you know, they've got all these health issues, it becomes more difficult. You know, going back to it becomes a lot easier. And so I think that the HIV figures are very important. Hepatitis C as well. We're busy doing a hepatitis C surveillance project where we're looking at levels of Hep C in different communities. And that's very important as well. There's a huge burden on the public health system because of that. And I think the other thing as well is that we've got very good examples of isolated communities where this hasn't been done. So last year in Scott County in the United States, we saw a massive increase from about 5 cases per year of HIV up to 170 in the first 6 months of the year. They had no needle and syringe programs, no opioid substitution therapy, none of these kind of things going on. And as soon as they introduced them out of necessity, they saw those levels drop. It's no coincidence that Russia has the highest level of HIV transmission through injecting drug use. 9 out of every 10 infections in Russia are by injecting drug use. They have no opioid substitution therapy. They have no needle and syringe programs. In fact, they're outlawed. And you know, the evidence speaks for itself. Yeah.
Finally, Sean, you've been very outspoken about how high-level interventions are required to ensure the barriers to service delivery are reduced. What are some of these steps that should be taken or could be taken?
Well, first of all, we need to accept that drugs aren't the root of all social evil, and often it is the social discordance and inequity that drives drug use. All right. Not all drug use is negative either. There are a lot of people that use drugs non-problematically. But for the people that have problems with their drug use, that's often impacted by policy and by criminalization of drug use and criminalization of the people who use drugs, which really is marginalizing the already marginalized. We're not seeing the same effects on people in different areas to the ones that we see these devastating effects. So first of all, we've got to look at those large systemic issues. But in the practical here and now sense, we need to start looking at opioid substitution therapy being available in the public health system at primary care level. It shouldn't be a specialist thing. It should be low threshold services. We need to expand the needle and syringe programs as well, because they're the first point of contact. And then we need to get over this whole thing about trying to stop people using drugs. We need to say we're willing to meet you where you're at and create the space, or as a friend of mine says, the scaffolding that they can support a vision of future self until they are strong enough to support that themselves. And that's what we do. We show compassion, we meet people where they're at, and miraculously we find they get better. It's not us doing it, we're just being nice. You know.